the first thing that I sense is massive confusion. People not knowing where we are going as a healthcare system and what the impact is going to be on them personally. Which leads to, and the part that I worry about the most, which is what's going on in our physician community. And again, widespread confusion, but beyond that, anger. And that concerns me a lot.
If you ask him, Mike, what's driving the anger, is it the uncertainty that's driving the anger? Is it the change that's driving the anger? What's driving the anger?
It's, I think, the uncertainty and the fear that what they were hoping to attain in going into medicine is somehow going to be removed. They're absolutely committed to patient care, but they also expected that they get a fair income for devoting so much time to preparing to become doctors. And I think the uncertainty of what that revenue potential is for them under this new reform activity, I think is creating the confusion and the anger, because I think they all believe it's not good what's going to happen.
I think they are concerned about their individual incomes, but I think they're mostly concerned, are they going to be able to have the freedom to take care of the patients the way they want to?
Exactly.
Everyone that became a doctor went into it for the right reasons. I'm actually optimistic that we'll work our way through this, and our physicians will maybe even have more freedom to practice the way they should. But right now, they're very uncertain about that, and I think a lot of them are going to either leave practice or change how they practice.
Yeah, I think you bring up the issue, I'd call it professional prerogatives. And I think prerogatives, I think most physicians look at it in that frame of reference. You know, I am a professional, I make choices. Now, some of them don't like the idea of evidence-based medicine because it restricts, you know, it sort of tells them, you're a cookbook medicine, et cetera. So a lot of this evolution is getting at professional prerogatives. The other point is age. There are those who are just going to say, either I'm going to retire or all I want to do is last within the existing framework. I'm not going to change because I'm going to go 5 years and then I'm going to retire. Or I'm going to retire. You hear those. Then you hear those who don't have that flexibility, and they're angry. And then you have the young ones who are probably going to evolve to it and are probably over time the answer to all of this.